Well, frequently when people think they have depression, what they're experiencing is the blues. People oftentimes will say, I'm feeling depressed. It's more the blues. And the blues is something that is transient. It comes and it goes. The blues are something that we normally experience and frequently throughout our lives, especially with stressful situations or if the day isn't going our way. We just sort of feel down in the dumps and then we come back from it. The blues, when we experience the blues, we're not really feeling an attack on our self-worth. We don't do an attack on our bodies, and it doesn't last very long. As opposed to clinical depression. And clinical depression is a diagnosable disorder. And with clinical depression, what we oftentimes have are symptoms like gaining significant weight or having thoughts about low self-worth. We'll have suicidal thinking. We'll have experiences of very deep and sorrowful depression. We tend to isolate with it. It's a very different experience from what generally we would call the blues. With depression, we also experience a sense of disconnect from our world. And the irritability we sometimes experience with depression is a defense against that sadness that we feel from the disconnect. Now, depression isn't always bad. It sometimes brings some gifts with it, and one of the gifts that depression can bring with it is a different understanding of our world. It gives us a different view of our experience. And when we come out of depression, it gives us a more full experience of our world. Some of the symptoms of clinical depression are a very deep and profound experience of a loss of joy in life, a withdrawal from social participation. Significant weight gain or significant weight loss are also symptoms of depression. We can also have suicidal thoughts with depression. Depression oftentimes begins early onset. It starts somewhere between childhood and early adulthood when we have our first experiences with it. Depression also, interestingly, runs in families, so there is a genetic connection to it. In fact, if you have one parent that is clinically depressed diagnosed, there's a 50% chance that each of the children in that family will have some form of clinical depression in their lives. If both parents are diagnosed clinically depressed, there is a 75 to 85% chance that each of those children in the family are going to experience some form of clinical depression in their lifetimes. In the course of a lifetime, approximately 6% of the population will experience a diagnosable form of clinical depression. For children, it's very similar, but the symptoms are different. In children, you'll notice a drop-off in schoolwork. You'll notice irritability. Some hyperactivity you might notice with children as well. They don't socialize as well. They might get into fights on the schoolyard. They might not listen to their parents. So children will actually use depression differently. They will exhibit it more physically, and so you have to be aware of what those symptoms are. You have to be aware of who your child is and notice a change in their behavior to pick it up. Well, many people don't take clinical depression seriously because it's not something that's easily observable. It's not like having a broken arm where you can actually see the person is injured. Oftentimes people will just see it as an excuse for getting out of something or an excuse for a character flaw that they might have, rather than seeing it as a diagnosable disorder that needs to be treated clinically. It's actually not uncommon for people to tell someone who's depressed to just snap out of it. But people can't just snap out of it. It's not that easy. When people go into a clinical depression, they need some form of treatment. Some type of action needs to be taken to take them out of it. There are clinical differences in depression between men and women. It's very interesting because women are 2 to 3 times more likely to experience clinical depression in their lifetime. Men are socialized to hold on to their feelings and to not express themselves. And what they do is they internalize, they hold on to, they go into a depression, but they're not really able to identify what they're feeling. Women, on the other hand, are socialized to talk and to communicate, and it's okay for women to express what they're feeling. Now, what happens is in the brain structure of men and women, it's a little different, and it makes it actually more difficult for men in the brain structure to identify what they're feeling. It doesn't mean they're not feeling sadness, it doesn't mean that they're not feeling this pain, but they have a harder time making a connection and putting words to what they're experiencing. So when they try to put words to it, it fails them, causing them to withdraw and to retract themselves even more socially from others. Women, on the other hand, because of the way the brain structure works, are able to identify their feelings much more quickly. And so they have a word for it, and they can put it into language, they can talk to their friends, and they're more likely to go into therapy. Men also have been socialized to pull themselves up by the bootstraps and to just buck up and just take it and go forward. So they're more likely to dismiss the symptoms that they're feeling with clinical depression. It affects them just as seriously as it does women, but they won't reach out for help as easily or as readily as women will. For more information on depression, you can go onto my website at latherapist.com, and for self-help, you can check out my other website, which is hypnocd.com. I'm happy to answer any questions that you have.